Hello friends, in my previous video I discussed with you about some tips related to your Toacs preparation. Today I am going to discuss with you about Toacs syllabus. In your syllabus, these are the 14 modules in which your clinical knowledge is assessed. We will discuss this one by one. First module is teaching. The most likely domains to be assessed are good communication between the candidate and the trainee, information gathering, communication with patients and families, communication with colleagues, applied clinical knowledge, and patient safety. Examples of topics that could be covered here include teaching on practical skills based on OSATs. OSATs basically stands for Objective Structured Assessment of Technical Skills. Now, technical skills which are assessed in this modules are making surgical knots, episiotomy repair, instrumental deliveries, vaginal breech deliveries, conducting vaginal twin deliveries, manual removal of placentas, laparoscopy, hysteroscopy. Other topics which are included are conducting a tutorial, how to consent a patient for surgery, how to conduct an audit, electrosurgery or diathermy, fetal blood sampling, evacuation of retained products of conception, teaching how to read a protocol and how to produce guidelines, conduction of a fire drill, example on eclampsia, cord prolapse and massive PPH. Giving feedback, for example, on training, consent forms, letters to GP and multidisciplinary team, oncology letters. Conducting an appraisal, inserting a urinary catheter or pessary, dealing with bullying, undermining and underperforming colleagues. Module 2 is related to core surgical skills. In this module, the candidate is expected to demonstrate an understanding of the principles of safe surgery and how these are applied to specific operative procedures. These principles cover preoperative assessment, including pre- and post-operative ward rounds, intraoperative procedures, and complications arising thereof and their management. Consenting for surgical procedures, WHO safety checklist, and knowledge of the various surgical instruments used in the most common obstetrics and gynecological procedures are assessed in this module. Candidates should be able to understand and discuss the principles of managing complications of surgery, such as a perforated uterus, bladder, bowel, ureteric, and other visceral injuries. For some of these complications, it is not expected that the candidate will be able to manage them, but an understanding of how these are managed immediately, who to call and what they may do, for example, and in the long term, including counseling, incident reporting, and risk management, would be tested. Examples of potential areas for assessment include: number 1 are surgical procedures. Caesarean section, especially when they are associated with pathologies such as adhesions, fibroids, and placenta previa. Hysterectomy, vaginal and abdominal. Diagnostic laparoscopy, laparoscopic surgical procedures for common gynecological problems such as ectopic pregnancies and adnexal pathology. Evacuation of retained products of conception and complications including uterine perforation. Ovarian cystectomy, laparoscopic or open. Complications of surgery such as bowel, bladder, and ureteric injuries. For complications of surgery, recognition or suspicion, who to inform and when. Team in theatre, consultant, and specialty involved. If procedure is under regional anesthesia, informing the patient prior to embarking on exploration, investigation to confirm and manage the injury. Dealing with the surgical complication, example hemorrhage, collateral damage, etc. Managing the complication immediately and outlining plan for care after. Incident reporting, statics, etc. Debriefing of patient, communication with the general practitioner. Now, third module is post-operative care. As a member of the team managing women after surgery, it is an expectation that candidates will be able to understand the principles of post-operative care, including counseling, usually about what happened at surgery, what to expect immediately after surgery, on leaving the hospital, and follow-up. Debriefing, medication, thromboprophylaxis, fluid balance, catheter management, and indeed management of complications arising from surgery, and the rationale for the specified length of hospital stay, the benefits versus risk of short and long hospital stay, daycare surgery, and care in the community. The candidate should understand the principles of enhanced recovery following surgery and be able to demonstrate this to the examiner. The assessment of communication here is likely to be with the patient, family, and colleagues. Examples of areas that could be assessed include discussing post-operative care of women who have undergone various surgical procedures such as hysterectomy with or without bladder injury, exploratory laparotomy, unplanned procedures, and complications. Updating a patient information leaflet about a surgical procedure such as laparoscopy, hysterectomy, tubal ligation, etc. Care of women who have undergone complicated obstetric procedures such as cesarean hysterectomy, ruptured uterus, classical cesarean section, massive PPH managed by Bruce suture, etc. Our next module is antenatal care. This module is one with a wide range of topics that can be assessed. Important here is an understanding of the principles of routine antenatal care as outlined in NICE guidelines. Why and when is care classified as low risk midwifery care or high risk consultant care? How plans are made and varied as determined by risk factors. Which are these? And the concept of multidisciplinary care, communicating with midwives, general practitioners, and various professionals, example, colleagues from other specialties, etc. A very common form of assessment here is with simulated patients, where history taking, obtaining information, and communicating with the patient and colleagues is undertaken. Examples of areas for assessment here include medical disorders, example diabetes mellitus, thyroid and other endocrine, cardiac, gastrointestinal, pulmonary, renal, autoimmune, connective tissue and neurological disorders in pregnancy. Pregnancies complicated by growth abnormalities, small for gestation age, growth restriction, macrosomia and polyhydramnios. Complicated pregnancies, hypertension, preeclampsia, multiple pregnancies, monochorionic and dichorionic. Placental abnormalities, breech presentation, obstetric cholestasis and antepartum hemorrhage. Ultrasound scan, fetal abnormalities. Prenatal diagnosis, screening tests, amniocentesis, chorionic villus sampling, and non-invasive prenatal testing. Non-invasive prenatal diagnosis. Preterm pre-labor rupture of fetal membranes. In preparing for this module, there should be a focus on taking a relevant history, initiation of appropriate investigations, and being able to justify these. Providing information to the woman and her partner and family. Making a plan for management including timing of delivery and being able to justify your plans. It is important to recognize that there are controversies in care and that the opinion of the patient is important in decision making. Module number 5 is maternal medicine. This module is similar to module 4 in that it is able to assess the candidates on any of the 5 domains: patient safety, information gathering, communication with the patients and the families, communication with colleagues, and applied clinical knowledge. Here, however, the student is expected to demonstrate an understanding of the etiology and pathophysiology of most of the maternal medical complications of pregnancy, such as the common endocrine, hematological, renal system, including transplant, cardiovascular, example cardiac disease, hypertension, respiratory, example asthma, gastrointestinal, example inflammatory bowel disease, Crohn's or ulcerative colitis, neurological, examples epilepsy and headaches, and musculoskeletal, examples spina bifida and pubic symphysis dysfunction disorders. Assessments in this module will include tasks aimed at the candidate's ability to provide or understand the rationale for preconception care, antenatal and often multidisciplinary care, including intrapartum and postpartum care. It is important to remember that for most of these medical problems, there is usually a two-way approach to their management. The effects of pregnancy on the condition and that of the condition on the pregnancy. Examples of tasks in this module include endocrine problems in pregnancy, diabetes, thyroid and Cushing's syndrome, respiratory problems, asthma, gastrointestinal, ulcerative colitis and Crohn's disease, musculoskeletal arthritis that affects the pelvic and spina bifida, connective disorder, systemic lupus erythematosus, Marfan syndrome and antiphospholipid syndrome. Cardiovascular includes hypertension, essential or otherwise, cardiomyopathy, various congenital cardiac malformations, and Eisenmenger's syndrome. Hematological include sickle cell, thalassemia, anemia, bleeding disorders, especially inherited, ITP and TTP. Transplant, renal cardiac transplant. Renal includes chronic renal failure on dialysis. Neurological include epilepsy, headaches, intracranial hypertension, infections in pregnancy, mostly cytomegalovirus, HIV, chickenpox, herpes, hepatitis, syphilis, etc. Module number 6 include management of labor. This module allows for the assessment of the 5 domains, particularly patient safety and communication. A very sound knowledge of the process of labor and how it affects various physiological and pathological changes associated with pregnancy is crucial to the management of labor. Here, applied knowledge is essential. Communication is central to effective care of women on the labor ward, and this happens at various levels with patients and their partners and with staff, senior, junior, midwifery, other specialties like anesthesia, hematology, chemical pathology, microbiology, virology, blood bank and neonatology at various stages and during handovers. Here the SPAR acronym is very useful. Recognizing normal and abnormal labor and how to manage these are central, and so too is prioritization of tasks on the labor ward. Examples of tasks under this module include induction of labor, unstable lie, vaginal birth after cesarean section, poor progress in labor, precipitated labor, prioritization board, management of complications of labor, previous difficult labors, example PPH, third or fourth perineal tears, shoulder dystocia and ruptured uterus, or preterm labor. Module 7 is related to management of delivery. This is a continuation of module 6 and again lends itself nicely to each of the 5 domains of assessment. Here your decision making and its timing are critical and will be assessed. The trainee must be well versed with the management of normal and abnormal delivery, including complications resulting from these. Important of this module is risk management and patient safety, especially with regards to counseling after poor outcomes, including breaking bad news. Examples of the tasks include labor dystocia, forceps delivery, ventouse delivery, elective cesarean section, emergency cesarean section in the second stage, postpartum hemorrhage, uterine rupture, preterm labor, intrauterine fetal death, delivery and management, retained placenta, uterine inversion. Module 8 is related to postpartum problems, the purpurium. Having delivered the baby, it is not unusual for problems to arise after. These could be maternal or neonatal. For the trainee, the focus of assessment under this module is mainly maternal, although occasionally there may be a task on the neonatal problem. Irrespective of the problem, you should not forget to communicate with the midwife and the patient's general practitioner through discharge summaries and letters. Ultimately, these are members of the healthcare team that would be involved in the care of the woman. Typical problems include maternal collapse, retained placenta, postpartum hemorrhage, primary or secondary, lactation problems, poor lactation, and lactation suppression in those opting not to breastfeed, mastitis in women, breastfeeding, appropriate contraception, perineal trauma management now and in future pregnancies, infections and management, wound infections, psychiatric problems, bladder problems, neonatal jaundice and feeding problems. Module 9 is gynecological problems. This module covers a variety of gynecological problems, elective and emergency. Assessments here would easily cover the 5 domains detailed earlier. Examples of potential tasks including those with simulated patients of this module include menstrual disorders, primary and secondary amenorrhea, dysmenorrhea, irregular periods and oligomenorrhea, developmental abnormalities of the genital tract including congenital malformations, pediatric and adolescent gynecology including puberty and pubertal disorders, general gynecological endocrine disorders, emergency gynecology, adnexal accidents, miscarriages, ectopic pregnancies, menopause and hormone replacement therapy, pelvic pain and endometriosis, vaginal discharge, benign tumors, fibroids and ovarian cysts. Module 10 is related to subfertility. This module covers all aspects of infertility, seeking information from couples, attending with infertility investigations and making a diagnosis, and counseling and providing appropriate treatment. In this module, patient confidentiality is very important, and equally important are the ethical aspects of assisted reproduction. A candidate should be able to take a good history, initiate investigations, and understand when and how various aspects of assisted reproduction technology, including ovulation induction, IVF, ICSI, etc., are offered. Equally important is an understanding of the investigation and management of couples presenting with recurrent implantation failure and pregnancy losses. Examples of tasks that can be assessed under this module include female infertility, male infertility, counseling about various aspects of assisted reproductive techniques, ethical aspects of ART, recurrent pregnancy failures. Important to consider here are confidentiality issues around investigation results from couples, gamete donation, confidentiality and ethical aspects, offering ART for social reasons, importance of age, etc., gamete storage and the ethics of this in single women, men or couples delaying childbirth, ethics of treating same-sex couples. Module 11 is related to sexual and reproductive health. This module covers contraception, including understanding the United Kingdom Medical Eligibility Criteria (UK MAC), or sexual health, including sexual transmitted infections, same-sex relationships and their associated problems, and termination of pregnancy, including the laws governing this as well as the procedures for termination of pregnancy. Safeguarding vulnerable women and children forms part of this module, and an understanding of these is important for assessment. Examples of areas that can be assessed include choice of contraception and when to discontinue in the over 40s, options for contraception in women with various comorbidities or contraindications to some of the options, surgical contraception, long-acting reversible contraception, complications of various contraceptive options, emergency contraception, immediate, medium and long-term counseling, sexually transmitted infections, problems of same-sex relationships. Module 12 is earlier pregnancy care. This module focuses on early pregnancy complications and their management. A candidate should not only be very knowledgeable about each of these complications but should be able to demonstrate how to manage these, including how to perform surgical procedures and also discussing the options of care with the patients. The topics covered in this module include nausea and vomiting in pregnancy and hyperemesis gravidarum, miscarriages, the different types, ectopic pregnancies, and trophoblastic disorders. Possible tasks from this module includes management of molar pregnancy, scan with a complete mole, hyperemesis gravidarum, ectopic pregnancy, diagnosis and management options, cervical and cesarean scar ectopic pregnancies, various types of miscarriages, threatened, inevitable, complete, incomplete, and septic, review of histology reports and appropriate management. Example, complete, incomplete mole, ectopic pregnancy, but no chorionic villi in tube, or evidence of decidualization in endometrial curettage. Module number 13 is gynecological oncology. At this level, most trainees will not be expected to manage gynecological oncology problems independently. However, they will be expected to understand the principles of pre-malignant screening for vulval, vaginal, cervical, and endometrial cancers, the staging of these cancers, how these are investigated, and the various treatment options, especially in the context of a multidisciplinary team, as well as cancer targets, including timelines from referral to treatment. The principles of chemotherapy and palliative care, including psychological support, would form part of this module. Examples of tasks in this module include explanation of the results of investigations to patients and management. Example, breaking the news that the patient has cervical, endometrial, ovarian, vulval cancers, etc. Management of an abnormal cervical cytology, investigations and management of ovarian, cervical, endometrial, and vulval cancers, management of choriocarcinoma, chemotherapy and radiotherapy, principles, indications, and complications, principles of palliative care, including pain control and dying. Module 14 is related to urogynecology and pelvic floor problems. An average specialist should be able to manage most urogynecological problems initially and only refer where first options have failed. She should therefore understand the anatomy and physiology of the pelvic floor and the urinary tract, especially the bladder, the pathologies that arise when there is abnormality in either anatomy or function, how these are investigated, and the treatment options including medical and surgical. Complications arising therefore should be understood as well as how these can be managed. Trainees are expected to interpret urogynecological investigations and appreciate when to seek information to inform decisions on managing women with bladder outflow problems or overdistension. Some of these problems may arise as complications of deliveries or surgery, in which case there may be an overlap with some of the other modules. Examples of tasks in this module include urinary incontinence, pelvic organ prolapse, urinary retention, investigations of urinary incontinence, urodynamic investigations, discussion with the patient, and the management options. Thanks for watching. If you like my video, please subscribe to my channel and click the bell icon for more updates.